Thank you for joining me, especially in this time and in this format. I really appreciate it. So I'm thinking that my target audience here today is probably other clinicians working with traumatized individuals and couples therapists. And now, if you're not in my target population, please, of course, follow along, as I think you will benefit from this. Now, I have 4 ACEs. And that may mean something to you. I've had the pleasure and privilege to work with traumatized folks for the last 20 years, but I'm also a trauma survivor. And again, my ACE score is 4. And again, that may mean something to you right now, but certainly by the end of the talk, you'll understand what that means and know exactly what your ACE score is as well, and why you should even care about an ACE score. So by the end of my talk today, you're going to learn how to identify and treat trauma. You're going to know what an ACE score is, why you should care about it. And we're going to take the ACEs questionnaire together so you can know your ACE score if you don't already. And then how to use this really simple but effective tool immediately in your practice, whether you're working with couples, individuals, in clinics, schools, hospitals, community centers. It's something that you can really make good use of. While none of my slides or videos today are going to be graphic, they might touch on some tender places inside of you. So take good care of yourself. Really use the benefit of us being on Zoom. And if you need to step away, look away, look at your phone, take a bathroom break, just please feel free to do so. During my talk, again, I'm going to ask you to take this ACEs questionnaire, and it can be triggering. It's a bit intense. So do what you need to do to take care of you. Now, I am sure most of you know or have your own definition and understanding of trauma, but I wanted to quickly go over it here as a refresher. So trauma, a traumatic event involves a single experience or enduring repeated or multiple experiences that completely overwhelm the individual's ability to cope or integrate the ideas and emotions involved in that experience. Or more easily stated, it's any event that overwhelms our nervous system and our ability to cope. That's trauma. Now, ACE stands for Adverse Childhood Experience. It is the largest study of its kind ever to examine over the lifespan the medical, social, and economic consequences in adults of adverse childhood experiences. So this is a landmark study that showed a profound link between 10 types of childhood trauma and the adult onset of chronic disease, mental illness, being violent, being a victim of violence, among many other serious health consequences, to include a decreased lifespan. Now, this was a groundbreaking, like absolutely groundbreaking study, originally conducted when? In 1995. Now, again, this is October of 2021. And I'm talking to you about this study. And the original study was from the CDC, Centers for Disease Control, and Kaiser Permanente partnered in this groundbreaking study together. But what's so horrific in my mind is that this study is so absolutely significant and impacts all of us, yet still many, many people don't know anything about it. Now, many people do, and maybe you, my audience, and I'd love to hear from you if you know all about it I'd like to know if you know your own ACE score, and I hope you do, but if not, you will soon. But it's just such an important tool and study, something I think we should all know something about. So while we hear trauma all the time, right? We're inundated, I'm sure you are as well, in your mailbox with all these trauma presentations, trauma-informed dentistry, trauma-informed everything. It's really the zeitgeist, right? But some are overlooking and not using this very important tool, or the study itself, just really understanding what this study has taught us. And when I say some, I mean not just us as mental health practitioners, but teachers, clergy members, physicians, principals, youth leaders, social workers, judges, attorneys, family court attorneys and judges. In fact, I gave this or very similar presentation to, thank goodness, family court judges and attorneys. Now, I want you to know I didn't get invited back, though, so maybe they didn't want to hear about it. But in 2019, I did present this to them. Now, if you want to know more, and you haven't seen this viral video by Dr. Nadine Burke, I'll also link that in my notes. And she discusses the ACE study, and I'll link it for you. I just didn't put it in here because I'm thinking maybe many of you have already seen it. Now, I've worked full-time in private practice, as Melissa stated earlier, as a clinical psychologist for over 20 years. I only see adults, but I say I work with kids all the time, right? Because there's, within every adult, of course, there's our inner child. Now, most of my clients, of course, are educated professional folks that are really suffering in their lives. But when I ask them if they've experienced childhood trauma, most, and when I say most, I mean like 95% will say, my childhood was normal. So I've just stopped asking the question, actually a long time ago. My practice is over 50% of couples, and when they come to see me, they have no idea that it's their childhood that is likely their problem that's interfering in their marriage or partnership. Do you know what they think their problem is? Couples, when they come in, what do you know about what they think their problem actually is? If you work with couples, you know it's their partner. That's the problem, right? That's all you need to change. Change my partner, and my marriage or partnership is going to be just fine. That's kind of universal in all of us. So here are a couple graphics I keep in mind. So only sharing in my mind while working with folks to think about what I deem as absolutely foundational in all the therapy work we do. Relationship with ourselves, and an understanding of the self. So relationship with self and an understanding of self, right, as depicted by these two images. Now, many people who have survived childhood trauma don't know it, as we see when they come into our office. They're just completely unaware. And I know many of you, if we were all in a room together, you'd be screaming, yes, yes, because you see it also and hear it also. It's just such an epidemic that so many folks that come to see us seeking relief from their suffering never have acknowledged, or they know little about their own childhood trauma. I have, and I'm sure you do too, dear friends, not clinicians, not mental health practitioners, that absolutely do not correlate their adult misery, failed relationships, depression, job dissatisfaction with their own childhood trauma. There's no correlation or no thought that what they went through might be affecting them in their life now. So while trauma is the focus of the day, or what I like to say is the new kale, right? It's just, we hear about it and talk about it all the time. It still has not really penetrated society as deeply as it needs to. Okay, I'm going to step off my soapbox. That's enough for a little while. Let's just jump in and let's go ahead and take this ACE survey. It's only 10 questions long. And I'm not going to ask you, my audience, to reveal anything publicly. So you don't have to say anything in the chat. I'm not going to ask you to raise your hand and share your score. This is just for your private information, so you can know your own score. So please, if you will, do take the test along with me. Now, about a third of you, or maybe more, because this is kind of a self-selected audience, like who would tune into this talk or go and find this talk later, is someone who's already thoughtful about trauma, adverse childhood experiences. So many of you might actually be surprised at your score. But I want you to know it's not all bad news. There will be some good news as we move along in the talk. All right, so let's move along here. So remember that you're answering these questions all before your 18th birthday. So again, I'll read these aloud and you're answering yes or no all before your 18th birthday. And if the answer is yes, you score 1 point for each yes. And so that means a total of 10 possible points. And if the answer is no, of course, you don't not take a point for that question. Make sense? Let's dive in here. Did a parent or other adult in the household often or very often swear at you, put you down or humiliate you, or act in a way that made you feel afraid that you might be physically hurt? 2, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? Did an adult or person at least 5 years older than you ever touch or fondle you, or have you touched their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? Did you often or very often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to each other, or support each other? Did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, had no one to protect you? Or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Were your parents ever separated or divorced? Was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her? Or sometimes, often, or very often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Did you live with anyone who was a problem drinker or alcoholic, or who used street drugs? Was a household member depressed or mentally ill? Or did a household member attempt suicide? Did a household member go to prison? Now tally up your scores. You're going to have a score between 0 and 10. And again, I'm not asking you to share that. That's for your personal business and use. And we can look at this slide just as a guideline as we use even the ACEs survey. So it's not deterministic, but I did want to show you. So I told you that the original study was 17,000 participants. Now, if you've ever conducted any kind of your own research, you know that 17,000 participants is a very hardy study that's not easy to replicate, and that is numerous participants. And I want you to know that it was Kaiser, as well as the CDC, as I said earlier, that was recruiting these participants. So from many walks of life, but at least people who had insurance, right? So it doesn't even capture some parts, of course, of the population. But 64% of the 17,000 study participants had at least one ACE. And my guess is you probably have at least one ACE. Now, if you don't, fantastic. And 36% of the 17,000 had 0 or endorsed 0 adverse childhood experiences. 26% 1, 16% 2, 9.5% endorsed having 3. This is where I live at the 12.4% having 4 adverse childhood experiences. So what does this all mean? What does it mean? On this slide, we can see here that the higher your score, the more likely you are to smoke, to become an alcoholic, to overdrink, take antidepressants or other prescription medications. And these are just a few of the possible adverse side effects and events. And there are many more, such as people with 6 ACEs, so 6 or more ACEs, adverse childhood experiences, died nearly 20 years earlier than those without this ACE score. So 6 or more take 20 years off your life, given what happened in your childhood. I mean, that is just profound. And that's not all. This shows you how likely you are to attempt suicide based on your ACE score. So you see with the score of 0, a very, very small chance of ever being somebody who attempts to take your own life. But as your score increases, so does your chances of committing suicide. So adverse childhood experiences are highly correlated with people who are suicidal or complete suicide. In this slide, I just want you to see the progression of what happens when we experience ACEs. And just to see that this is not just a problem of childhood, right? And we grow out of it. Children who repeatedly and chronically experience adversity suffer from toxic stress. Now, we all know as clinicians, or even people in the public, there is good stress, but there's something called toxic stress coming from these ACEs that happens when the brain endures repeated stress or danger, then releases the flight or fight hormones like cortisol. This internal alarm system increases our heart rate, blood pressure, and really damages the digestive and immune systems. Toxic stress can disrupt organ, tissue, and brain development. Over time, this can limit a person's ability to process information, make decisions, interact with others, and regulate emotions. And I can imagine that as you're hearing this, you each know somebody that fits into this, or it's you. And these consequences, now my slide says, may follow a person into adulthood, but I say follows a person into adulthood. I have not seen where there are not some effects in our adult life. So ACEs are not just a problem of childhood. Oh, goodness. We're going to watch a quick small traumatic event take place. I wonder how many of you here in my audience have ever seen this classic video by Ed Tronick. I assign this to every couple I work with. I don't watch it with them in my office, but they must go home and watch this. It's classic and very powerful. Now, I just returned yesterday from a very high-end wellness facility. Some of you may know it. It's called On-Site. I did a training this last week, and there were couples intensive at this facility. And they showed this video, and it really helped the couples like understand each other in a new way. So I want to encourage you to, if you don't already know about this powerful video, watch it here with me, but also give it to if you're working with couples, share it with your couples and even individual clients. It's just great. Go ahead and play this for you.
In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this. And then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, "Come on, why aren't we doing this?" Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big.
This video is so absolutely significant in that it shows us the good, the bad, and the ugly. You see, we're not born with a self, right? Our self is born out of attunement, attachment, and being felt, or what Dan Siegel talks about, mind sight, right? Really feeling the other. And that's how this self is developed, or not developed with many of the folks that we see. Now, when I do see couples, I know that they come in with so many complaints, right? Affairs, finances, in-laws, parenting, addictions. But at the heart of the matter, it's always lack of attunement. Sometimes attunement with the self, but oftentimes with each other, and really knowing how to co-regulate with one another. Now, I want to give you an assignment to try at home. Please indulge me on this one, because this attunement stuff and still face stuff is not just for our clients. It happens in our own life, right? So I want you to experiment, and you might be at home, but you might be at work. Not sure where you're tuning in from, but just try it. Go home, or if you're at home, interact with your partner and stay still. Have no emotions at all when they talk to you, and be monotone and still-faced. And you will see very quickly, you will misalign and you're going to get into a fight, or you'll cause irritation. Now, you don't need a partner to try this out. Do this with your kids. Do it with a friend. Do it with your neighbor. You will see how powerful that it doesn't just happen in infancy, right? As adults, we want to be attuned to, attended to. And we do that through our voice tone, eye contact. It's so absolutely important. Now, you've already had this experience, I'm sure of it. You've been with a friend, colleague, coworker, and they're on this thing, right? Like you're talking to them and they're like, oh yeah, da-da-da. How many of us, you can just feel it in your body, right? It's like our biggest desire, right, is to be seen, heard, and known. And we don't like this when we're trying to talk with a friend or our kids, or so it's so important. And I please do try it out in your life, because it's endlessly interesting. And also do the opposite. What happens when you really tune in? I'm trying to think about, Stan Tatkin, if you know him, wonderful couples trainer, talks about amplifying the positive. Did you see the sunset today? Yeah, I saw the sunset. It was amazing, right? It feels so good when you amplify the positive, when you do that with your kids, with your spouse, and you want to decrease the negative, right? And amplify positive. It's wonderful for relationships. And some of you may be thinking, yeah, I know that feeling when you're like, look at the full moon, right? Doesn't feel good. Okay, so the impact of toxic stress, this toxic stress we were talking about earlier, is chronic fight, flight, or increased cortisol. Not a good thing, which changes the brain's architecture. Now that's so significant and important. It changes the brain's architecture, leaves us with a hyper-responsive stress response. And we know all about that. We see that. We try to work with this in our practices. And it's also why we do trauma therapy. Because thanks to neuroscience and neuroimaging, we can see the effect of trauma using PET scans. There is no doubt that trauma affects brain development. Trauma interrupts the brain's architecture, as I was saying earlier. In infancy and toddlerhood, our brain is developing 1 million neuronal connections each second. Now really think about that. 1 million neuronal connections each second. It's the most important, well, there's two very important times of neural development in our lifespan, but infancy is one of them. Do you know what the second one is? Adolescence, during the pruning phase. Now, the stress hormones So when we're stressed because of trauma, they block these neurons. So I always think of it like a firecracker going off in the brain. So trauma is like a firecracker and it shatters the memories into many parts. So if you're asking someone who is traumatized, hey, what happened? Expect that there's not going to be what we know as a clear and coherent narrative. Well, this happened, then this happened, and no, it's a firecracker, right? So you're only going to get parts of the story or fragments. And that is because when we have a traumatized brain, it's not going to be coherent. It's not going to be whole. That's why we seek trauma therapy, right? For coherence and integration. And it can be very helpful when talking to folks about trauma to begin with somatic feelings they recall, asking what they felt, heard, smelled. They will likely have more access to those sorts of memories first. Now, what I'm sharing with you is true for folks who were traumatized a long, long time ago, and those who just recently endured a traumatic event. The result is the same, because as we know, the body keeps the score and it doesn't know time. It doesn't keep time. So it doesn't matter how long ago a traumatic event happened, the body can bring it up in a minute as if it were yesterday. All trauma therapies are about helping to create a whole, a clear and coherent narrative, putting the pieces of the firecracker together. And not just putting the pieces together, but the emotions as related to the pieces, creating a gestalt or a whole, also known as healing and recovery. Now, I know we talked about defining trauma earlier, but what you probably saw on the ACEs is it doesn't cover what we as clinicians know to be traumatic. I mean, certainly it covers some of what we know to be traumatic. And I just wanted to make sure that these other traumatic events can be highlighted. You'll notice that the ACEs survey does not address racism, witnessing violence outside the home, bullying, spanking, losing a parent to deportation, living in an unsafe neighborhood, any involvement with the foster care system, being home, living in a war zone, being an immigrant, moving many times, witnessing a sibling being abused, witnessing a father or other caregiver or extended family member being abused, or any involvement in the criminal justice system. These can also be significant, of course. And here are additional possible side effects from an ACE score or a high ACE score. So there's behavioral consequences as well as physical and mental health. So we see lack of physical activity, smoking, alcoholism, drug use, missed work. Those are the behavioral consequences. Some of what could be the physical and mental consequences: severe obesity, diabetes, depression, suicide attempts, as we saw earlier, STDs, heart disease, cancer, stroke, COPD, and broken bones. Okay. So just the now, this is my last video, I promise. It's just so also extremely important. And when I practice, whether on Zoom, which has been for a long time for all of us now, but I now see folks also in person, I ask for eye contact, and I think that's really, really important. let's watch this video and I'll say a little bit more about that.
People are just setting up chairs in public spaces and inviting complete strangers to sit in front of them. Not to have a conversation, not to debate, but to simply make eye contact with another human being. And people that actually go for it are having profound experiences. Now, as you notice as you watch this video, it doesn't matter what the other person's race, gender, age, or political beliefs are. In this moment, they are simply two human beings sharing an experience together. It's something that we don't do enough as a society, and it's something that I believe can truly change the world, to know that you are part of something much larger than just yourself, to look into somebody's eyes and see their humanity.
I don't know how many of you have seen this, but it's so powerful. There's another one with an artist in residency that's also beautiful, and I'll link that because it's really something to see. But eye contact is so important when we're working with folks, but also in relationship with each other. Now, for many years, I did couples therapy, and they sat side by side on a couch. Now, do you know how most couples get in fights? Think about it with your spouse or your partner. Where are you most likely to start a fight, get into a tussle with your loved one? When you're not eye to eye, face to face. Oftentimes in the car, it can happen. It can happen when we're in the kitchen and we're trying to get a meal prepared, but it's not eye to eye, face to face. So thank you again, Stan Tadkin. Finally, many years ago, I switched my office over to rolling chairs. Now, you don't have to have rolling chairs, but at least put your couple in a chair and have them face each other. That alone will change your couple's therapy, I promise you. You want them looking and talking to each other as you facilitate and help. Now, you might say, well, I don't even know who these people are coming in the first session. And I hear you. So my first session, I do have them sitting in the more traditional manner that we were taught maybe in grad school, right? That they might be side by side. Well, I hear their story, make sure that there's no domestic violence. But then right after that, so if not in that first session, certainly by the second session, they are face to face. And when they talk, I tell them, talk to the other, I'll listen in. Please, if you have the ability, if you do couples work and you're not already working face to face, make that one change and you will see your work change. It's really amazing. And with your own spouse, friends, when you go to have difficult conversations, do it eye to eye, face to face, body to body. You'll have a much more successful outcome than when we just quip at each other. Because as again, Stan Tadkin teaches us, this is threatening, right? But this, you can see maybe my intention, the care, hopefully in my eyes. So really, really important. Now, at this point in my talk, if we were all together in a room, and that would be great if we were, I'd ask you to pair off. So you'd all be strangers, very likely. And I'd ask you to find somebody you don't know. And I'd ask you to engage in 1 minute of eye contact. No laughing, no hugging, no touching, just looking at one another. And you would be so surprised at how quickly you connect, just like we saw in this video, with a total stranger and feel empathy for another. Very, very profound. So if you do group therapy, it's a great exercise. Okay, so trauma-informed care factors. We know this, right? We have to create a safe environment, build relationships and connectedness, supporting and teaching emotional regulation, right? This is psychology 101, right? We learned this. Be attuned to your client. Have, what is it? Unconditional positive regard. I mean, how many times did you hear this in your program, right? Your master's, your bachelor's, your doctorate. Create a safe environment. We all know this. It was taught to us over and over and over. But we also know we need more. Like, this is great, it's foundational, but we need more to help people heal. So remember that talk therapy alone is not trauma therapy, right? Talk therapy is top-down processing. It's why there are many beautiful self-help books available. I own a ton of them. But that's why we can't just go and read a book and heal ourselves, right? That's top-down processing. And that's not what heals trauma. So trauma has to be bottom up. So talk therapy is my third slide here, right? Where we see the green, that's top down. But methods such as emotion-focused therapies, EMDR, brain spotting, psychodrama, neurofeedback, somatic experiencing, those are all bottom-up approaches, and that helps heal trauma. Now, there are many others I didn't mention, many others that also are effective. But these affect our emotional and limbic brain, as we see in number 2, the blue, the emotional part of the brain. So we engage feelings to get to the facts. We engage feelings to get to the facts. I am sure all of you know this guy, right? Fantastic. Who I call the godfather of trauma treatment, Bessel van der Kolk, who, by the way, says he does not like talk therapy. He says it's not all bad, but for trauma treatment, he poo-poos it. And if you don't know, Dr. Bessel van der Kolk is still alive, well, and teaching. In fact, he just gave a seminar a couple of weeks ago, and we'll be doing another one. And he says being able to feel safe with other people is probably the single most important aspect of mental health. Safe connections are fundamental to meaningful and satisfying lives. And just think about your own life, right? If you have just even a few, 1, 2 meaningful and satisfying relationships, you feel safe and connected to just 1 or 2 people, it's significant, and it's more significant now than ever, right, during this pandemic time. So it's not all doom and gloom with the ACE scores. Remember, we're just using the ACEs as kind of guidelines and also helping our clients to see, like, that is trauma and it's going to affect you later in your life. Now you each know your own ACE score. And like all risk factor research, the results are not deterministic. And they're not deterministic because of protective factors, which can buffer the effects of trauma. So having a helpful teacher, a neighbor, a clergy person, close social relationships, just someone to talk to, can all serve as buffers against the trauma we are enduring at any age or stage of our life. But of course, most significant in childhood, right? When are we most vulnerable in the world? In our childhood. We can't raise ourselves. We need others. So you can build resiliency if you have these other protective factors. So remembering what is not revealed and felt cannot be healed. So we have to be able to tell our story, reveal, to be healed. Now, this is maybe going to be a little controversial for some of you to hear, but we can also heal in our love relationships. In fact, this is where we finish our unfinished business. So if I'm working with an individual who suffered trauma, together we can help him or her to heal. But I always say to my clients, it will be in their primary love relationship, should they choose to have one, that will take them the rest of the way in our work. It can't happen in my office. So I can certainly help an individual have healing and recovery, but the last bit of healing and recovery will come from an intimate love relationship. I think that's the part that's going to be controversial, and many of you might disagree with me on this. So when we get couples in our office, this is not what they are thinking, right? They don't think that they've married their unfinished business. Thank you, Harville Hendricks. Most look at me like I am crazy when I tell them they can help one another more than I can help them individually. However, through this psychoeducation piece, and even more importantly, having them attune to themselves and really take a look at how their inner child and their partner's inner child was harmed is key. And so ACEs is one tool to help them assess their own childhood trauma, share this with their partner, as long as there's no domestic violence in their relationship. This is, the couple bubble has to be safe to share with your partner your ACE score. But if I see that the couple bubble is safe, I do have partners do this in couples therapy. So I want you to have this huge takeaway from the ACEs study. Trauma is not what happens to you. Trauma is what happens inside of you as a result of what happens to you. And that's our beautiful Gabor Mate. And if you don't know Gabor Mate, I will, please let me know, because I'll link to you. I want you to know him. Beautiful, beautiful psychiatrist from Canada who's done tremendous work on trauma and its effects on the body. Has written a few beautiful books, and just a wonderful person. Not as well known as Bessel van der Kolk. So if we were all in a room together, what I'd want you to do is say this with me. So if you will say, trauma is not what happens to you. Trauma is what happens inside of you as a result of what happens to you. This is my final slide in the closing of my talk. You listened today about the largest landmark study that altered the way we view trauma. You each became personally acquainted with your own ACE score, the ACE questionnaire, and its significant impact it has on us throughout the lifespan. We learned about the profound impact of co-regulation and its effect on your everyday life. Please remember the still face video. And lastly, we learned that as trauma-informed folks, we offer and encourage eye contact. Please remember the eye contact experiment that we didn't get to do here together, but you saw a clip of a video with eye contact. We also know to never expect a linear story when we're working with folks that have been traumatized. Remember the firecracker analogy. And always, always, when working with folks, ask, what happened to you? Not what's wrong with you. What happened to you? Now, thank you for everyone who's hung in there with me for this hour. I want to thank you so much for your attention. I want to thank you for your service. You know, nobody goes into this helping profession hoping to get rich, right? It's not why we do this. You do this because helping others is your calling and it matters so much to your spirit. I want to thank you for your service, your work, and your care about our world and those around us. And I want to tell you, if I can ever be of further service to you, please be in touch with me. My website address I'll list below, but it's www.drfallynn.com. And just thank you and bless you and have a beautiful, beautiful afternoon.